A 10-member UK emergency medical team, which arrived in Namibia last week, has taken well to their task to assist in curbing the spread of COVID-19. The arrival of the 10 specialists follows the government's request for medical staff through the World Health Organization and the British government. The team of medics will be in the country, for the next 6 weeks and will be placed at various health facilities across the country. Judge d'Affaires Charlotte Fenton, as well as team leader of the UK EMT, Elias Pavlopoulos, are now joining me with more details. Good morning, ladies and gentlemen, and thank you very much for being here.
Good morning.
Good morning. I would like to start with you, Mrs. Fenton. The team is here, as I mentioned, to assist Namibia to curb the spread of COVID-19. Could you please give us a brief background of how this came about?
Certainly, thank you. So the UK Medical Emergency Team came here to Namibia following a request by the Ministry of Health and Social Services to the WHO for international medical assistance to help Namibia in the fight against COVID-19. As you've just said, there are 10 members of the team. They're all international experts in a variety of fields, including emergency medicine, infection protection and control, critical care, public health. So they will be working on all these sectors and others during their time here in Namibia. Diseases don't respect borders, and none of us will be safe until we're all safe. So the UK is making a crucial contribution to the global fight against the COVID-19 pandemic, and it's in our national interest to do so.
Now, we've seen the UK emerging from a particularly very difficult COVID-19 experience. What are some of the lessons that the UK has learned that you are applying here to our country?
Well, applying it to the country is another matter. But if I can talk specifically a little about the UK. And with, I mean, one of the main lessons learned is vaccines. Quite frankly, vaccines are the way out of this pandemic for us all. We're all in this together. Put simply, vaccines have already saved thousands of lives, and it's vaccines that will help us fight this long-term globally.
Now, Dr. Pavlopoulos, the team is made up of 10 members. These are specialists. What are some of their roles and that they will be focusing on?
We have a team, as already said, Ms. Fenton, comprised from 10 specialists in the areas of public health, of emergency medicine and critical care that is very important for COVID. And we are here to provide trainings to medical doctors and nurses in the area of how to support serious and critically ill patients, and at the same time to help them in the organization of the services, and not only in the organization of the services, but also to prevent further infection and spread of the virus. In this way, I will say that we support in the area of infection prevention and control, and also we will support in the area of public awareness with messages and how to engage better the communities, so to ensure that the messages goes to the communities are clear and the people understand what is happening and how to be protected from the virus. I will say that is the most important part when you have to do in a pandemic. I work many years with epidemics around the world, and I can tell you the most important part is to protect the health staff. It's completely unfair to lose people from the health staff. If it's not healthy, our staff in the hospitals, we cannot be healthy, and this is very important.
And where are these members deployed?
All the people have international experience in different countries before they come here. We have some members of National Health System of UK, of the famous NHS, that they have very strong experience in dealing with COVID. And the most important thing of dealing with COVID is not only to have some experiences, to follow the evolution that they change every day, I will say, in new drugs and new medicines and new discoveries that we have in this field. So I will say that I was in Yemen, I was in Greece working with COVID-19. I can say that each country have different characteristics. And we have seen also in Namibia this big wave that you have 1 month ago with 150 deaths in the peak of the pandemic. It was quite shocking for all of us because it was one of the top in the world, and we want not to have something like that again. And the answer, as Ms. Fenton said, also is vaccination. Vaccination, vaccination, and vaccination is the answer.
True. These 10 member states, are they all working here in the capital city?
At the moment, we are in the capital city, and we support the central hospital, the ICU of the central hospital, and also in Katutura Hospital, the respiratory unit of the Katutura Hospital. We will be based in these two hospitals, and also will invite health staff from other hospitals around the country to train them and also to work together with them. And in this way, to build their capacity and to give them the tools after that to train other health staff. So let's say that we start with the people here in these two hospitals, we extend to the health staff from all over the country, and at the same time we discuss with Ministry of Health. Most probably in the end of our assignment, we'll spend some time also in Erongo region to ensure that there the situation also is covered.
All right. Now, Ms. Fenton, I'd just like to bring you in here. The UK has lifted most of its restrictions, as we've seen on television, where stadiums are full. You did mention vaccines, which could be the contribution to this. So what else made you confident to open up, and what are the current restrictions in the UK like? Are people wearing masks? Is it still a restriction?
Thank you. Yeah. So as my Prime Minister said last month, when the UK did start to lift the restrictions that had been in place, and I quote, "We want this country to be able to enjoy the fruits of our massive vaccination campaign. But to do that, we must remain cautious and we must continue to get vaccinated." The decision to lift restrictions is based on a number of factors, but overwhelmingly one of the most crucial points is that the UK has been able to vaccinate such a large proportion of the population. The UK will soon be heading into winter there, getting colder. We've seen here in Namibia how cold weather is a natural agent for the virus to spread further. If the UK were to leave the restrictions in place, it would be for a very long time.
Okay.
So there comes a point when restrictions do have to be lifted. It's a balancing game, right? We have to balance the epidemiology, we have to balance how the virus is spreading, but also allow people to live their lives as normally as they can, or with an element of normality. So that was kind of the key reason really for lifting restrictions. Now, there are still measures in place. Face masking is not mandatory.
Okay.
However, what the UK does have, and which is proving very effective, is the track and trace application. So anybody who is in contact with someone who's been tested positive for COVID-19 will get an alert, and then they know that they are potentially have been exposed to the virus. The latest change with that, though, is that anyone who has been double vaccinated no longer needs to isolate. They will be tested themselves in order to see if they're positive or not.
All right. Okay. Dr. Pavlopoulos, you've mentioned that you've worked on many pandemics before. So what has your experience with COVID-19 been like in comparison to the other pandemics that you've worked on?
I work with HIV/AIDS in Southern Africa, and I know your neighborhood quite well. And I was working also with Ebola in West Africa. I can say that the characteristic of all the epidemics is the fear of the people. Everybody, we experts or not experts, we have the fear of what will happen and how the things will be the evolution of the things. We didn't have an airborne pandemic like this one with COVID before and after the last 100 years. We have different kinds of epidemics that I will say. And I can say that the airborne diseases are always more scary than the other diseases because it's easier to spread. But I can say that in the fight, we are lucky to live in 2021, okay, that we have tools in our hands. We have testing. We had very fast, reliable test to be able to identify the virus. We have vaccines. We had in really record time, and this is very important because the technologies that was building through the last 15, 20 years, the technologies that used today in the vaccines. And for this reason, we have so fast these vaccines from different companies that are really effective and really save lives. And this is important to understand understand that because there is a lot of discussions about vaccinations and things like that, that is quite normal. The people are afraid in the pandemics and they are discussing about that. It's important to understand that the people that we call in the area of vaccine hesitancy are not all the same. They have different needs. We need to approach them. We need to approach the poor people. We have people that they cannot move from their home out to go to be vaccinated. Okay, so we have to approach all the different categories of the population that have problems to be vaccinated and to be close to them and to persuade them. And this is a very important public health message. Vaccination saves lives. We know it now.
Yeah.
We have more than 2.5 billion people in the planet have already received the first dose. Okay, so you understand that this is very important. And also, we have seen in a public health level that countries that have more than 50 to 60% of the population vaccinated, they still have very small amount of deaths, even though they have increased number of cases. This we follow day by day because this is very, very important to see how we'll evolve. But until now, the things that we are seeing giving us great hope that we can also work against this pandemic effectively.
Now, Ms. Fenton, the team, when the team wraps up after its 6 weeks, can we still expect the assistance from them once they are done?
Probably not from the team itself.
Okay.
However, we are continuing to explore ways in which the UK can support Namibia at this time and looking at every avenue that's available to us. At the British High Commission in Windhoek, we continue with our full spectrum of work. That includes things like we're working on opportunities for increased trade between the UK and Namibia. That will, of course, benefit Namibia's economy that has been so badly damaged by the COVID-19 pandemic. So yes, absolutely, we will continue. As I've said already, the UK is making a critical contribution globally to the pandemic, including through development of vaccines, deployment of vaccines, tackling vaccine hesitancy, and identifying new variants. And so we will be seeing how the UK can particularly help Namibia in those areas.
All right, so we are out of time and we are approaching the end of our interview. So could you please share with us your final remarks, Doctor?
I would say that please do your best as a country to have as much vaccines as possible in the shortest period of time. It's important to say that if Namibia is not safe, nobody is safe in this world. In this world, we are all together, we are all connected, and we need all the planet to be vaccinated, so to ensure that we finish with this pandemic. And I'm sure that we will do that, and we are here as UK Emergency Medical Team to support different countries in this fight against the pandemic.
Thank you very much. Ms. Fenton?
I completely echo what Dr. Elias has said. We've seen how devastating the third wave has been here in Namibia, how much stress it has placed on the healthcare sector. We need to do everything we can to ensure that if there are further waves of the virus here, that we can tackle it more efficiently without placing so much stress on the healthcare sector and on the healthcare workers. And by everybody getting vaccinated, as the doctor has said, that reduces the chance of people needing serious medical care.
Well, Dr. Pavlopoulos and Mrs. Fenton, we appreciate the aid that you're providing to us as a country to help curb this pandemic. And thank you very much for being here this morning.
Thank you for the invitation.
And I hope you enjoy your stay in Namibia, even though you're here to work.
We'll do that.
All right, so that was Charge d'Affaires Charlotte Fenton, as well as team leader of the UK EMT, that is Dr. Elias Pavlopoulos, and they were talking to us about a 10-member UK emergency medical team which arrived in Namibia last week to help curb the spread of COVID-19 in the country.